Hi, my name is Keating, and in this video today I'll be performing and inserting how to insert an indwelling catheter. So the first thing I'm going to mention is that I've already performed my hand hygiene, introduced myself to the patient, created privacy for my patient, and made sure my patient is in the correct position for the procedure today. So these two towels are going to represent my patient's legs. So now I'm going to proceed to my video for today. So the first thing I'm going to do is open up my contents of my kit, and I'll place my kit in between the patient's legs, and I'm going to create my outer kit as a trash can for my equipment I'll be doing. And I'm going to place this next to my patient's hip. So now I'm going to open my kit, and I'm going to open it away from me, maintaining my 1-inch border. Okay, so now that I've opened the kit, I'm going to mention that my entire kit is sterile. So now I'm going to don on my sterile gloves. So now that I have donned my sterile gloves, I'm going to come over to my sterile kit, and I'm going to remove the drape. And I'm going to mention that the shiny side and there's a dull side. I'm going to place the shiny side down because it is water protectant. I'm going to place it under my patient. Okay, so now I see that I have a fenestrated drape, and normally I would use this for a male patient, but today we're not going to use this. And now I'm going to remove the contents of my kit onto my sterile field and closer to the patient. So now I see that I have my iodine solution, and normally I would open this and pour it onto my cotton ball so I can prepare to clean my patient before I perform my inserting of my catheter, but today we're not going to use this. I'm going to place that over there. So the next thing I'm going to do is I'm going to take my lubricant, and I'm going to squeeze some of it out onto my my sterile tray. Okay. And now that I have placed my lubricant in my tray, the next thing I'm going to do is take my normal saline syringe, and I'm going to place it onto my catheter. Make sure it's on there good. And now I'm going to take the covering off my catheter and lubricate my catheter. So for when I lubricate my catheter, if I were placing my catheter into a female patient, I would lubricate it 1 to 2 inches. But if it was for a male, I would do it for 5 to 7 inches. So I have already lubricated my catheter. I'm going to mention again that I would lubricate the catheter for a female 1 to 2 inches, and if it was for a male, I'd lubricate it for 5 to 7 inches. So the next thing I'm going to do is I'm going to proceed to showing how I would clean my patient in preparation for inserting the catheter. So I would take my forceps and my iodine cotton swabs. They have iodine all over them, and I would take my non-dominant hand, and I would prepare my patient for the cleaning. I'm going to note that this hand would be unsterile now. So for a female patient, I would clean the labial folds, and I would clean the furthest one away from me from top to bottom, then the nearest one from me from top to bottom, and then I'd clean, and I would use a different cotton swab every time I did this, and I would clean the middle from top to bottom. Now for a male, I would still use the forceps and cotton swabs, and I'm going to repeat this procedure 3 times. So I would clean the urethral opening and the glands of the penis. I repeat that 3 times with different cotton swab balls each time. So the next thing I'm going to talk about is a bifurcation, and the bifurcation is this right here, and is the exposed inflation and deflation port. And it is important to note where the bifurcation is to make sure that you place the catheter correctly and to make sure that the balloon is past the urethra. So now I'm going to proceed to inflating the balloon on my female patient, and I'm going to note that I'm going to hold my unsterile and non-dominant hand. I'm going to hold the catheter stable with my unsterile and non-dominant hand. And before I start to inflate the balloon, I want to mention that I have already inserted the catheter in my female patient, and the catheter was lubricated and my patient was clean. So I'm going to go ahead and inflate my balloon. And after I have inflated my balloon, I want to hold pressure on the plunger and remove it and throw away my plunger. And then I'm going to pull back on the catheter until I've met resistance. And then I would advance the catheter so it doesn't hold pressure on the neck of the bladder. And so that would be for a female patient. And now I'm going to show you how I would advance a balloon, inflate a balloon for a male patient. And while this is deflating, I'm going to mention that my male patient was clean and the catheter was lubricated and it has already been inserted up into the bifurcation point. And so now for male patients, since it was up into the bifurcation point, I'm going to hold it stable at the bifurcation point, and now I'm going to go ahead and inflate my balloon. And the same thing, I'm going to hold pressure on my plunger when I remove it. And throw away my plunger. And so now I'm the same thing. I'm going to pull back until I have met resistance, and then advance the catheter so it doesn't hold pressure on the neck of my bladder. So the next thing I'm going to do after I have inflated the balloon on my male and female patient, now it's going to be the same thing that I would do for both male and female throughout. I'm going to take my stat lock and I'm going to place my catheter into my stat lock. I'm going to close it, and then I would take I'm going to clean my patient's outer thigh, and then I would adhese the stat lock onto my patient's thigh. And then I would take the urine bag and I would place it onto the bed frame and not on the bed railing, and make sure that I won't lift it above my patient's bladder. And so after I've done that, I'm going to make the patient comfortable, raise the side rails and lower the bed, and make sure that if they need any help, just to press the call light. And so after a patient who had just had a catheter placed, recently had a recent catheter placed, I would take my sterile container, and what I would do is I would have a towel laid down and a basin just in case any urine leaked out. But what I would do is I would open this, and I would unclamp I would unclamp this, and then I would hold it down and make sure I don't touch the sterile container, and I would unclamp it. Yes, I would unclamp it, and then I would make sure the urine is placed into there, and then I'd reclamp it, and then I'd put it back into the bag, and then I'd close this and send it off to the labs. Now that was for a recent catheter placement. So for a catheter that's been placed after a day or a couple of hours, I would get an alcohol swab, and I'd come up to this port and I would clean the port, and then I would take a syringe and I would attach it. Actually, before I did that, I would clamp off my tubing and make sure that some urine fills up. And then I would clean the top of this port, and then I would take a syringe and get some urine out of this.